BI3 is focused on creating sustainable systems and culture change. We are uniquely positioned to do this thanks to our strategic partnership with TriHealth, a leading integrated healthcare delivery system in Southwest Ohio. This partnership allows us to readily pilot and scale new approaches, such as the mom-centered approach to prenatal care, which we've been able to expand in the OBGYN center that serves a large population of moms who have Medicaid as their primary insurance. I am so excited to talk with my friend, my colleague, Jeremiah Kirkland. He is lead over women's services. He has really accelerated diversity, equity, and inclusion efforts here at TriHealth, and he was just named president of one of our hospitals. But above all that, he is a committed leader for change, and his passion drives others to action. Thanks for joining us today, Jeremiah. Welcome.
Thank you, Jill. Thanks for having me.
Nationally, Black maternal mortality is 3 times greater than white mortality. And we find that Black women suffer from higher rates of medical errors, of heart issues, lack of proper care coordination. So can you share with us how you're looking at improving maternal health within women's services, especially for those women who face racial, social, and economic barriers?
Jill, great question, and I'm happy to share with you some of our approaches, clearly some of which we've partnered on, but first we start with the problem. Like you've outlined, this has been a significant issue, not just here in Cincinnati, but throughout our region and throughout the country. And one of the ways that we have said we are going to address it right here in Cincinnati is through approaching the problem head on and focusing on how do we, one, hear from the community, hear from these moms, listen to them, take into account things that we might not have addressed or heard before because we've relied on our own information to address the problem. The first step was going into the community, listening to mothers who have said, the reason why we're having some of these outcomes is because we don't feel heard by our providers. We do feel like racism has played a role or implicit bias has played a role in the care that we received, and we are not listened to by our clinical providers and our care team. We took that information and then said, you know what, let's look in the mirror. How can we as an organization understand that we need to help address some of these needs in caring for these moms prenatally and then in the postpartum phase. And we said as a team, we can only do but so much. You know, we can control certain interactions in care and certain episodes of care, but that's not the full picture of what the patient is living through. That patient leaves our health system, leaves our doors, and they go out and they go into an environment that has impact on their health. They go out and try to look at what food they can purchase, their housing. All of these things play a role in the overall care for that woman and in the child, in the baby, in their health outcomes. So we have said in partnership with BI3, with our medical legal aid partnership, and with our partnership with other organizations throughout Cincinnati, how can we help address mom's needs across the board? How can we make sure she has appropriate housing, the electricity is turned on, that she's got the right access to food, and all of those social needs, and then also medical needs, behavioral health needs. How can we address those quickly? How can we work with the right partners to get mom the support she needs? And then make sure that she understands that we're partners in her care. So I think it's just been truly a collaboration, bringing the patient to the center, making sure we're listening appropriately, and then taking action through our partnerships.
So I'm going to ask you to expand a little bit upon that. Healthcare systems in the past have been somewhat siloed. And when we want to fix a problem, we think it's just easier to do it ourselves than in partnership with community-based organizations. So can you speak to the importance, and BI3 has fueled a lot of partnerships, like you mentioned, the Legal Aid Society and starting the Maternal Health Law Partnership at a high volume OB-GYN center that helps reduce those health harming legal needs for moms. I met Tamaya, who couldn't sleep at night because she had an electrical issue, and through legal aid they were able to resolve that for her in 3 days, and she could get sleep while she's pregnant. So can you talk about some of the challenges, but also why it is so important for healthcare systems to work in partnership with the community and not get siloed?
It really has to do with how that patient is living outside of our walls. I think historically we have been siloed because it reminds me of the saying, if you want to go fast, go alone, right? And as a health system, if we want to make quick changes, let's just do this by ourselves. Let's spearhead this. Let's move forward. We have people within our hospitals and within our offices. Let's move fast. Let's go. And we essentially go alone when we're operating just as a health system. But if you want to go far, you go together, right? And if we want to go together, that means incorporating lots of people in the community and listening to our patients and then taking action, partnering with BI3, partnering with other institutions. And we have failed to do that because we have operated alone thinking that our siloed health system has all the answers. Healthcare is mental, is physical, is spiritual, and we have to work to address all those three things as best as we can. And we only do that through partnerships. We best do that through partnerships. We've had instances and situations where a mom has come to us and said, I'm being evicted, and I have 3 children. I am 7 months pregnant, and right now the most important thing to me is making sure I have a home and a shelter for me and my kids. I am a single mother, and I don't have a lot of support. At that moment and at that time, we know that that mother is not thinking about coming to her next prenatal appointment. We know she's not thinking about, has she run out of prenatal vitamins and does she need more? She is thinking about food and shelter. And if we can't address those needs, we as a health system by ourselves, we don't have the infrastructure. We cannot write a prescription for housing and for additional food. The structure that we have set up as a health institution and a health system is very limited in our silo. But when we reach out and connect with partnerships in the community, we can immediately provide housing, find funding. We can help put a stop to an eviction. We can really try to drive those changes that help meet mom's social needs to get her to have better outcomes from a health perspective. And when she's ready to deliver that baby, we reduce stress, we improve hypertension, all of those things we're able to help when we look at all of those social needs together. And we only do that when we're in partnership with other organizations here in Cincinnati.
Agreed. And I'm so grateful that you and your team are aware of tracking outcomes because to achieve sustainable change, we have to push on payers, right? We need to prove that especially Medicaid needs to start reimbursing for addressing these social determinants of health. If we can address a small social issue that leads to a healthy pregnancy that otherwise may have been challenging, let's move upstream. But the only way to do that is to track the outcomes and collect the data and try to make a great case for change.
We know policy change and change to support reimbursement will allow many health systems, not just our health system, to get it right across the country to address these needs because they're in every community that I've been in.
In a national poll, 1/3 of Black Americans reported that they experience discrimination from a healthcare provider.
That is a very challenging statistic, and while I want to say that I wish it wasn't the case, I wish that was not the reality. Far too often has been the reality in many of the communities I've worked in, whether it's in New York or here in Ohio, or in Atlanta and other areas throughout the country. I have seen that to be the case. I've seen it reported in many instances, and it doesn't even matter of what someone's socioeconomic status is. You could be on the higher end or the lower end. Individuals have reported that they have felt that in some way, form, or fashion, and it shows in the data across the country. The reality is implicit bias plays a role in all of our lives, and implicit bias toward those of a different race, and specifically people of color, is a reality in every health system in the country. And I think we have to educate, we have to train, we have to develop, and help individuals think differently when approaching that very difficult topic. Challenging question, but the reality is I don't have all the solutions, but I do know there's some work that can be done across every health system in the country to improve it.
So BI3 has partnered with TriHealth, especially Women's Services, to offer implicit bias training, cultural competency training, but there's challenges to that work too. So can you speak to how that's going, some of the results you've seen from these trainings, and then some of the challenges you've had to face and how you've overcome them?
First and foremost, I am very grateful for BI3 partnering with us to help allow us to bring in really a world-class organization to help us with training and education. We cannot do this alone. We said, let's get on this journey. And it doesn't stop with one training. It doesn't stop with a 3-hour session in a classroom. So we said we have to look at these things and then understand that what might be coming into play when you have a bias. So unpacking these biases and addressing these issues help us be very vulnerable. I think sharing things that we wouldn't share normally comes out in these sessions. And then it helps us take some tools away. One really strong tool we learned about was how do we pause, stop, and think about what are we seeing? What are we about to say? How are we experiencing this interaction here? And I think it's just been very powerful.
It's important work. And you know, when you look at the data, right, and you mentioned this earlier, I mean, when you account for education and income, I mean, a Black educated woman has worse healthcare experiences than a white person who dropped out of high school. So there is racism at play there when you hold all factors, when you account for all other factors.
Yeah, that was probably some of the most difficult work in looking at and working and partnering with Cradle Cincinnati, looking at the data, looking at the facts, and saying that this is, you strip all of these things down on all of these factors to still have such economic and health equalities. It was extremely unfortunate to look at this data and see that every way we looked at it and turned, you could not ignore race when looking at overall outcomes. And I think that we had to specifically target how do we improve this systemic racism issue or this bias issue that's coming into play, and making sure these moms are heard, because what's happening here is that we are not, you can't just look at it as like the numbers without a narrative. The narrative is we have mothers and babies who are dying at an alarming rate. And in some cases, just by listening to that mom, Serena Williams, a primary example, just by listening, multi-million dollar tennis player and professional, and her voice isn't heard about care that she's received in the past and ignored about care that she thinks she should receive in order to help address her medical needs. And when we have issues like that come into play, how much more significant is it for a mom who's not Serena Williams, for a mother who isn't a known entity in the sports world or in the entertainment world, but it's just a mom in the community who comes in and says they feel pain or they need more medication, to not receive it. And a number of times we've seen that the worst possible outcome, that mother dies or the baby dies, or both. And I think we need to work, if we don't get everyone around this and to lock arms and to partner in the community to try to eliminate it, we are not going to see the outcomes we want to see.
So let's talk a little bit about healthcare and the need for diversifying our physicians, our clinical staff, because that plays a big role in trust.
Yeah.
So let's talk about one of our favorite topics, which is the School to Work program that you have taken the lead with Mark Clement's blessing on implementing here at TriHealth. And I know that you had experience with it in Rochester, but this School to Work program that provides internships for diverse students and really exposes them to all the different areas of healthcare, right? I mean, a lot of people, when they think healthcare, they think doctor, nurse, but there's all these different areas from radiology to pharmacy. So can you talk about the importance of this program? And I know it's changing lives for students, but can you talk about the importance of this program and your vision as it impacts the healthcare system?
It wasn't until I got into the School to Work program in Rochester that I realized healthcare is so much broader, and a health system or even a hospital system is so much broader. And you have radiology, you've got respiratory therapy and respiratory care, you have your nutrition team, you have pharmacy, you have your sterile processing team. You have so many areas that really help make the system run and operate. You've got your lab, you've got other core services. And I said, wow, this is like a whole different world to me. Like this is way more than I thought would be inside the operations of a health system. And I said, if we could, I got exposure so young, so early, and I learned that my passion was going to be in a hospital, working in healthcare, or working in a health system. And I quickly learned that if we could do this for other students, hundreds of students across a city, thousands of students across the state, hundreds of thousands across the country, we could make huge changes and huge waves in healthcare. So me being a young black man, stepping into a program like that 21 years ago, and still being in healthcare today, and now leading a hospital and leading a service line, I know where I got my start from, and it was a school to work program. So coming here, being blessed with the opportunity to partner with BI3 and with Mark Clement's support as our system CEO, giving us the green light to say, let's create that program here, and let's create a model for success that other health systems in this region and across the country can actually adopt. Is just amazing.
Do you feel like it can, over the long term, help diversify our healthcare workforce?
I think the program was designed to really help students get experiences in healthcare, and indirectly, I think that one of the things that has come out of this program, and which is now a more direct focus, is how do we diversify our healthcare and health systems? Because we know a part of building trust is culture and community, right? And if you have somebody who understands your culture, someone who's come from your community, and someone who can relate to you, and then oftentimes people who look like and reflect the community we serve, that trust is almost instantly built. And we know that through the School to Work program, we take students from the community, we put them in a community hospital, we give them exposure, we give them the skills, we give them the tools, and help build their knowledge to one day be healthcare professionals and come back into those hospitals and come back to the community and treat those patients. And these students are paid employees, they're working, so we're creating jobs. So when you talk about what's the economic impact of this work, we're creating jobs for a diverse population of students at a very early age. And then telling their parents to come apply for jobs as well, so they can partner with their student, their child, and work in our health system. So the great thing about this model is the ripple effect, and this model can be created and duplicated and copied and stole shamelessly once we create our handbook and how to manual. Because we want every health system in the country to embrace and adopt this great program.
That'd be awesome.
That's my wish. So
Mine too.
Great.
So what advice do you have to offer to other healthcare system leaders around addressing racial and health equity and inequities within the systems?
I would say I guess my strongest piece of advice is that you can't go in it alone. You cannot. There's no health system, no matter how big your balance sheet, no matter how much revenue and you bring in or profit margin you have, you can't go in at this alone, because this is a country-wide issue, and there's no health system that I have known or seen or worked with yet that has said they have achieved the success they need to alone. Go into the community and find out what's being done in the community. Ask your patients, ask your people, ask your team members. Team members offer great feedback because they oftentimes live in that community and there's things they want to see. And then look around the table and make sure that there's diversity around that table. Don't
Including
think
those with lived experience.
Exactly, those with lived experience. Make sure that you have a diverse and inclusive table of folks you're getting information from, taking feedback, and then start building on on that information and on those sessions to create action.
Well, I'm going to throw the gauntlet and challenge healthcare systems to think about identifying one or two health disparities. I mean, for us, it was infant mortality because, we have neighborhoods that have some of the highest infant mortality rates in the country. But identify one or two health disparities, and to your point, start having conversations, even with competing healthcare systems, right? No one's competing over health disparities. So how can they come together in new ways? Which I know is challenging to come together with competing healthcare systems, but how can you come together and really rally the community to start to improve a few health disparities together?
I think looking at it as a community issue and not as a market share competition issue, how can I gain more? What do I gain? I think looking at the data collectively and saying, of your patient population, what are you seeing? Do we have any common themes? If 5 health systems in an area got together and said, we are going to tackle diabetes in this community. We are going to tackle, asthma in this community. We're going to tackle hypertension. We're going to tackle, colonoscopies and colon cancer screening. If organizations got together and said, how do we tackle this together, and worked on some of those health disparities, we would see a lot of progress, and then we could put a lot of energy and effort toward those things.
Final question.
Okay.
So as you think about the progress we've made, and we still have a long way to go, but the progress of our collective efforts to continue to reduce infant mortality, especially for Black babies here in Cincinnati, and the culture change that we've been accelerating here in our own healthcare system, what are you most grateful for?
I would honestly say I am most grateful for the commitment, because I don't think we get anywhere without the commitment. And commitment means more than dollars. It means more than resources, supplies. It means more than people. It means more than time. It is giving up something. Oftentimes I look at commitment as, what are you giving to something? And it may be a combination of all those things. It may be money, it may be resources, it may be time, it may be energy, it may be effort. We're getting a lot of that great commitment now, and I'm beyond grateful for it, and I'm just happy that we are in a place where we have so many committed people that no matter what we see from an outcome standpoint, they want to continue to do the work. And even though we've seen a big win this past year with the results we've seen, the best results we've had in a decade, everybody's committed to doing more. So I'm very grateful for that.
And I'm grateful, when you talk about commitment, healthcare systems across the country have shown true commitment during this pandemic. And my hope is that they continue that commitment in new ways, especially to address health disparities.
Yes, I agree. And I think that if we can do that, if we can get together as health systems and partners in the community and do this as a country, then I think we will see a lot more in elimination of health disparities and really helping to improve the diversity amongst our workforce, improvement in equity, improvement in inclusion, and we will improve the health of our population because, as I said before, and I'll say it again, we are better together.
Better together. This moment matters.
Yes, it does.
Thanks, Jeremiah, for talking with me today.